In this video, we will discuss respiratory protection and health hazards in the workplace. Health hazards are a major concern for both employers and employees because many substances that are health hazards can become airborne, and knowing about self-protection is very important. It should be noted that before an employer would provide any employee with a respirator to use in a workplace, the employer must have created a formal written respiratory protection program and have every employee who will wear a respirator medically evaluated by a licensed healthcare professional. Health hazards in the workplace are a major concern for both employers and employees. It is important to remember that hazardous materials only present a health hazard when they come into contact with our body. Hazardous materials can enter our body in 4 ways: ingestion, skin absorption, inhalation, and injection. Note, inhalation is the most common way hazardous material can enter the body. What is a respirator, and when is it needed? A respirator is a protective device that covers the worker's nose and mouth, or the entire face and head, to keep airborne contaminants out of the worker's respiratory system and provide a safe air supply. The purpose of a respirator is to protect your health and safety. According to OSHA, employees need to wear respirators whenever engineering and work practice control measures are not adequate to prevent atmospheric contamination at the worksite. Strategies for preventing atmospheric contamination may include enclosing or confining the contaminant-producing operation, exhausting the contaminant, or substituting with less toxic materials. There are 2 major categories of respirators. A. Air purifying respirators, which use filters, cartridges, or canisters to remove contaminants from the air that you breathe. B. Atmosphere supplying respirators, which provide you with clean air from an uncontaminated source. Respirators safeguard workers against environments with scarce oxygen content, smoke, fog, mist, harmful dust, gases, sprays, and vapors. These hazards may impair lung function or cause cancer or other diseases. They may even be fatal. OSHA states that individuals with beards, mustaches, sideburns, or stubble will be unable to don tight-fitting respirators because facial hair interferes with the seal of the facepiece. OSHA also maintains that respirator tests will not be performed if any hair growth exists between the facepiece's surface and the skin against which it's supposed to seal. Employees are also required to remove or alter clothing that interferes with the respirator's proper fit. Persons performing tasks which require the use of a respirator must be physically capable enough to execute the task while using the respirator. Workers must be medically assessed by an OSHA-certified physician or a licensed healthcare professional before they are required to wear a respirator. Contact lenses can be worn with respirators. Since eyeglasses or goggles may interfere with the seal of half facepieces, it is strongly recommended that full facepiece respirators be worn where either corrective glasses or eye protection is required. The National Institute for Occupational Safety and Health maintains that the user must check the respirator seal before every use. The respiratory training program must supply employees with the necessary medical information so that they are able to recognize symptoms, such as shortness of breath, dizziness, or coughing that comes from the use of ineffective respirators. Things to remember. 1. The most common way hazardous material can enter the body is through inhalation. 2. Persons performing tasks which require the use of a respirator must be physically capable enough to execute the task while using the respirator. 3. Respirators safeguard workers against environments with scarce oxygen content, smoke, fog, mist, harmful dust, gases, sprays, and vapors. These hazards may impair lung function or cause cancer or other diseases. They may even be fatal. For more information about respiratory protection, be sure to ask a supervisor or consult your employee handbook.